Good morning, everyone. This is the special second hour of the Wellness Radio. Dr. Rebecca Warren here from doctorswarren.com. We have a health center located here in Chattanooga, Tennessee, in Hamilton Place, right across from the YMCA, next to the Home Depot. And we do virtual health coaching all over the U.S. You can find us on Facebook at Doctors Warren. And so we're usually here every Saturday morning from 10 to 11, and we usually get some special Saturdays where we get to be here from 11 to 12. I always get the times mixed up. And so when we get these 2-hour shows, we get really excited because we really get to jump in deeper when it comes to health and overall health and specific things that people have for us, questions or what's going on in our office. We can really go deeper in regards to your health concerns. And so for today's show, I'm going to be focusing on women's health and women's hormones. And so I'm going to be talking about estrogen, progesterone. I'm going to be talking about adrenals and thyroid. And the reason why I'm going to talk about this is because this is what a majority of my clients right now, that's who I am coaching through reclaiming their health. And what I find is that the biggest issue for women when it comes to their hormone health is lack of education. It's understanding that what they're experiencing is completely related to what's going on with their hormone levels. And the difficult thing with that is that when you're a woman and you're suffering with hormone issues, you can go to your doctor over and over again. But if you're listening to this right now, if you're married to a woman who has hormone issues, or if you yourself or your daughter or someone else, what you find is that no matter what hormone issue you have, when you go to the doctor, whether you're going to your GP or OBGYN, the answer is all the same. You have low hormones, get on a pill. You have bad periods, get on a pill. You have thyroid issues, get on a pill. And it gets tiring. It gets tiring after a while to follow those recommendations, to get on the pill, whether it's a thyroid pill, whether it's a hormone replacement pill, whether it's a birth control pill. It gets tiring because you'll get on that, and eventually it can, for some people it can help short term, but then longer term you're just going to end up in the same issue. So I want to make sure that if you guys are listening, I'm going to do something special today. You can go on Facebook at Doctors Warren. I am live right now, and if you have any questions, make sure you comment on that video or send it through a Facebook message. Or you can call live here at the studio at 423-267-1023. Again, that's 423-267-1023. I know I'll have to say that again, but if you have any questions about hormone health or anything that I'm talking about, comment on the Facebook Live. I will answer it, message, or call us here at the studio, and I'll make sure that we get that answered for you guys. So let's talk about this. What's really cool is that I had a young girl in my office yesterday. Well, she's going into the wellness. So in our office, we coach people through an intensive portion where you're doing a lot of changes. A lot of people are getting adjusted. A lot of people are doing nutritional changes. A lot of people are supplementing. And then once you get past an intensive part of their healthcare in our office, then they get into what's considered the wellness. And the wellness is still working on your health, but also maintaining it. And the reason why we do that in our office, we created this wellness network within our clinic, within our coaching clients, is because health is forever and life is crazy and we live in this toxic world. So unless you're actively working on your health every single day of your life, yes, you can lose it. Yes, you can wake up one day and have a diagnosis that's severe. And I see that all the time. Just the other day I had someone in my office with a new consult, and she was like, I just don't understand how just diabetes happened. Like, I just don't understand. I felt fine, but my A1C was like a 7. Like, it just it feels like it happened overnight. Well, guess what? It did not happen overnight, okay? So you have to understand that when you're working with your hormone health, that once you get it balanced, you're going to feel great, you're going to lose weight, you're going to think clearly, like your energy is going to be amazing. But what you've got to understand that when you're under stress, when life gets crazy, if you're in an accident, trauma, different stressors, emotional, chemical, or physical, can knock you out from being balanced. You're just going to be more sensitive to that. And I did this interview with a woman. Her name is Laura Adler, and she's a toxicology kind of like expert in regards to environmental toxins. And she said, what's really crazy is that the toxins in our environment when we study them, we only see what's going to kill you or what's going to cause these severe reactions. But when it comes to our hormones and when it comes to toxins in our hormones, it's in whispers, meaning very little can really push our hormones out of whack, which means there's so much that you can do for it. But anyways, young girl in our office, Ren, she is amazing, and she came into our office because she was having cycle issues, and she had shared her story with me. I would read it straight off my phone, but I'm using my phone to be on Facebook Live. And so pretty much what happened is that she was having really, really painful periods and cysts, just really painful, starting at a young age. And so, of course, you go to your doctor, and if there's something wrong with your cycle, or if you're quote unquote hormonal, if you're struggling with anxiety and depression, that's what you're going to do. And then what usually happens is, if you have a good doctor, they'll talk to you, but a majority of the time, what they're looking at is you have this symptom, this symptom, this symptom, let's just take this pill. And that's what happened with her. At a very young age, she was put on birth control. And birth control helped for a couple of years, but what you've got to understand, that birth control is not addressing or even influencing what the problem is. It's completely cutting off the connection from the brain to the ovaries. So you're pretty much saying, okay, body, you're really screwed up. We're just going to ignore what you should be doing, what God created you to do, what science says physiologically needs to happen from the body, and we're just going to depend on this pill. And then after a couple of years, she just wasn't feeling great. She was gaining weight. She was having severe digestive issues. She was nutrient deficient, which, just so you know, those are all side effects of the pill. And so she came into our office, and she was ready. She came in actually for thyroid issues. So you're going to see by the end of this show how, when your estrogen and your progesterone and testosterone are off, the thyroid is already off, or it's going to be off. It's only a matter of time. You're not a separate, broken down system. So she came in to see me for Hashimoto's. And so, she didn't realize that when she came in to see me, I'm not treating your Hashimoto's. I'm going to help your body get well. So your Hashimoto's, that's going to improve. Your antibodies are going to go down, but we need to address this hormone issue. And so she got on this, healing eating plan, paleo, keto. We coached her through it. She was able to start detoxing her body. And she said, Doc, I'm really nervous. I want to come off my birth control, but last time I did this, it was horrible. Like, when I came off of it, it was the pain I was feeling before times 10. But she had just had a cyst while on birth control, and she was like, I want to come off of it, but I'm scared. I'm like, you can do it. It's different now, because the thing is, when you stop taking a medication, you can't just stop taking it. There's a reason why it was prescribed in the first place. You got to do it safely, but you also have to address why you had to take it in the first place. If you address that problem and you support your body, then you're able to safely and easily come off of these different types of medications. So she worked with her doctor, came off the birth control, and it's been like 4 cycles now. And I just ran into her yesterday in the office. I'm like, how are you doing? She goes, I feel great, but I just hope this. I'm like, no. It's going to last. This is different. When you commit to your health, when you balance your hormones, you get well. And then we talked about how there's so many women out there that can lose weight. They do a keto or the Weight Watchers. You can lose weight, but in no way are you healing your hormones. So that when you stop eating Weight Watchers, and when you stop eating keto, when you stop, doing plexus, guess what happens? You gain it all back. Yeah, I just said plexus because my God, it's everywhere right now. Guys, in the end, what it looks like is that you need to reconnect with the way you were created to eat, and then make it detailed according to what your deficiencies are, to what kind of support you need. You need to detox your body, and you need to increase nervous system flow. In the end, when you remove your stressors, your body gets well. I don't heal anybody. Ren, I didn't heal her. She healed. She put in the work, and her body healed herself. And the cool thing is, that's a really big deal for a young girl to be able to come off birth control and not be in pain and have crazy cycles. But the cool thing is, she's like, I'm going into my wellness, and there's so much more I want to achieve and work on. So for you guys that are listening to this, if you're a woman, I don't care what age you're at and everything that you've gone through. I have women coming into the office that are like, I had someone recently in her 30s that had hysterectomy because of endometriosis. I have women that are just going through menopause or went through menopause and don't want to take this hormone, medication to replace what should be there. Doesn't matter where you're at, your body is created to heal. If you can hear me right now without you having to thinking about it, your brain is functioning, your heart is beating, your lungs are breathing. As long as your heart is beating, your lungs are breathing, you're hearing this right now. If you get a cut, you heal. You have that same healing potential for everything else in the body. So why is it that you're not getting well because of your thyroid issues? Why don't you feel well though you took thyroid medication? Why are you still having hot flashes or feeling anxious or feeling depressed? It's because you're going to go see, you're seeing someone that isn't getting down to the cause. It's because all you're doing is supporting your symptoms, and over time that's just going to get worse. So before I jump into, we're going to start off with the thyroid and sex hormone connection. Before I jump in, I want to let you guys know, if you're listening to this and you're like, man, this is my wife, this is my sister, this is my daughter, this is me. And this is the difference though. It can't just be you. It has to be you saying, I want to do something different with my health. Give me a call, set up an appointment, set up a consult to sit down with me. Sophie is standing by. You can give her a call. That number is 423-362-5360. Again, that's 423-362-5360. I have set appointment times in my schedule, and we have you block out about an hour and a half of your time. Why? Because we do go through a lot of information. And my goal, they make fun of me. My husband makes fun of me, Dr. Nathan, because it is like I am like an investigator. Like, I'm looking at your health history and I'm like, I'm going to find all the things your doctor has ignored, and I'm going to show it to you why you're here, and I'm going to show you how when you correct those things you can get well. And so that includes everything when you call her to set up that consult. We don't do labs in the office, but any labs, any paperwork that you guys have, you bring it in. Actually, you're supposed to submit it ahead of time so I can look over it. So give us a call. That's number 423-362-5360. Now let's talk about this whole thyroid thing. So, when I first opened up my clinic here in Chattanooga, I didn't really see thyroid people. I was just very focused on structural correction and just the chiropractic side. But Dr. Nathan really, challenged me because I had been coaching people around the U.S. I wasn't doing it here. And the reason why I was coaching people is because I'd spent the last 14 years looking at the thyroid research just to get my own health on track. A quick recap, at 19 years old, I was diagnosed with thyroid cancer. My thyroid was cut out, was given radiation, and then I was let to go, saying that I should be completely great because I was on a pill, the same pill that thousands, hundreds and thousands of people are on, the stinking Synthroid. And so when you take the Synthroid, the stinking Synthroid, you think that all your problems are going to go away, and they don't. And when women come in and they're on Synthroid, they're like, I just don't understand. I've been taking Synthroid for 5, 7, 20 years, but I still feel X, Y, and Z. I still feel like I can't lose weight. I'm anxious. I'm foggy-brained. I feel depressed. And it's like, well, number one, you're not even, your doctor's not monitoring it the right way. You're not supporting your gut to make sure that you're absorbing it, and you're not supporting your liver and your gut to make sure you're converting that T4 to T3. So when I decided to start, taking on these thyroid clients, I realized that for a lot of you guys, the thyroid isn't even the first thing. The thyroid is because of X, Y, and Z. The thyroid is because your gut microbiome is a mess, and because your gut is a mess, you have leaky gut, and it's creating this autoimmune reaction. Or you had weird cycles throughout your life, whether it's short cycles, irregular cycles, heavy cycles, painful cycles, and you thought, well, I had a hysterectomy, or I had a partial hysterectomy, or I was on medication, I should be fine, and then their thyroid issue popped up. So a majority of people I see, the thyroid is because of, it is not the cause. It is something that is influenced because of an imbalanced body. Now we're going to go on break here. So this is the Wellness Radio. I want you guys to know when I get back, I'm going to talk about what you need to look at when it comes to your thyroid, and then we're going to go down that path of the estrogen and progesterone issue that a majority of women have. When you have a symptom, it is not to be ignored or to be covered up with Midol, is to listen to your body, to know it's telling you something, and to support it. And the best way to do that is to have a good practitioner on your side. If you guys would like to set up a consult with me, it can be here locally in Chattanooga, in Hamilton Place. That's where our clinic is. Or we can do it virtually. You can give me a call or Sophie a call at 423-362-5360, and we'll see you right after the break. All right, so here goes D. Okay. D, Dr. Rebecca, I'm excited to find you on Facebook. My daughter and I are patients of Dr. Samantha. I love Dr. Sam. Okay. My daughter has Graves' disease and follicular carcinoma in both lobes of her thyroid when she was 17. She underwent total thyroidectomy and 2 treatments of radioactive iodine. She's on tyrosine, but still can't get her thyroid hormone to a normal level. She never feels well. All right, here we go. So that's right down my alley. Okay, so there's a few things with that. So what I said during this first segment is that, once you get your thyroid cut out and then you get on radiation, you've already kind of set your body up to kind of struggle in certain areas. And then the fact that you're completely dependent on a medication to feel well, you have more opportunities to have low stomach acid. You have more opportunities to have a imbalanced gut microbiome, and your liver becomes sluggish. So this is what I found with people that have had Graves' disease and follicular carcinoma is that, and I don't know if it's encapsulated, because if it was encapsulated, doctors are now saying that if it's an encapsulated follicular carcinoma, that usually it's fine if you just leave it alone. So that's a really interesting thing to look into, because what that means is if it's the carcinoma or if it's encapsulated, she's 5 years post-thyroidectomy. Okay, so this is the thing. Let me go ahead and go down the line. It's number one, she still has to treat her body like she still has the problem, meaning you have to still find out what caused it, because you need to address that cause. And so I'll give you, for example, with me, I had my thyroidectomy and my life was completely transformed by chiropractic, eating healthy, and taking supplementation. But after I had kids, it couldn't continue that way anymore. After I had kids, which are big stressors, so when she gets a really big stressor in her life, the problem's going to show up even more. So what I found out is that a lot of thyroid carcinomas and Graves' disease are associated with toxicity. So even with my own health and people that come in to see me with thyroid cancer, toxicity is a big major factor. So you've got to detox at a deep cellular level. The next thing is this, is that, like I said, when you don't have a thyroid, it's very easy for you to go hypo and not catch it. And the second you go hypo, your gut microbiome gets out of whack because you lose stomach acid. So if you're losing stomach acid, it really creates an environment where you don't have healthy bacteria, and then you're not absorbing your medication well, and you're not converting your medication well. So I'm about to go back on here. Stay tuned, I'm going to talk some more about that. But if you guys would like to set up a consult, you can definitely set up a virtual consult by giving the office a call. Welcome back, guys. This is the Wellness Radio. Dr. Rebecca Warren here, talking about all things female hormones. Sorry, guys, it's just for the ladies. But that's not a good thing. I'm having to talk about this because a lot of ladies are really suffering and looking for answers, and it's kind of chaos. So I am Dr. Rebecca Warren from doctorswarren.com. You can find us on Facebook at Doctors Warren. I am live on Facebook right now. If you'd like to watch me, ask a question and comment, or message me on Facebook, you can do that. Also, if you are listening to this and you're like, hey, I have some questions, I can't go very specific with your health, but if you have some general questions about what I'm talking about or something that you've heard when it comes to your hormone health, you can give me a call here at the studio at 423-267-1023. Now, let's just jump in to the thyroid stuff. Okay, so talking about the thyroid. Now, I just had someone that commented on my Facebook page about having, thyroid cancer, getting the thyroid cut out, and being on thyroid medication. Now, the problem is this, that when the thyroid goes dysfunctional, a lot of doctors, endocrinologists, are a little cocky about this, okay? If you're an endo, you're listening to this, yeah, I'm talking about you. You get a little cocky about this because you think that you can just medicate it or cut it out or radiate it and you're good to go, and that's just complete crap. Because what you're saying is this, is that a healthy organ that was there, that had been functioning well for years and decades, now is not functioning. So instead of saying why, we say cut it out, or burn it out, or forget about it and just take some hormone medication. That's pretty much that is what we're doing with thyroid right now. And if you're not on medication, then they wait and see. And the reason why this is problematic, just cutting it out or just taking a pill, is that the problem is only going to get worse. A sick body is trying to tell you something with your symptoms, and so you can medicate the thyroid, but guess what? Skin issues, gallbladder attacks, digestive issues, constipation to diarrhea and back and forth again, anxiety, depression. These are all common things that when women come in, I'm like, hey, do you have this, 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 and this? And they think, whoa, like, how do you know that I'm suffering with all of that? I was like, because I've spoken to enough people that are not getting the help that they need. It's insane. If there was a pond full of fish that were growing a third eye, no, biologists or whoever it is that, the science people that take care of them, they wouldn't look at these fish with a third eye and say, whew, a third eye, throw some pills in the water and let's see what happens. No, that's insane. They look at a species of animal that's, adapting differently, or if they're growing a third eye, they say, let's look at the environment, let's test the water, let's see the pH balance, let's see the food that they're eating, and let's see how we can influence the pond so that this is not occurring. We do that with fish, but when it comes to humans, we say, whatever, let's just medicate it. So when you end up medicating it, all that ends up happening is that the problem can continue to get worse. Also, a common thing I see is that if you have an autoimmune issue with your thyroid, like a Hashimoto's, is that you can get on a dosage and be fine and whoa, for the first time I'm losing weight and I feel good. But then over time, you lose that good feeling, and in fact, you go backwards. And unless your doctor's increasing your dosage, you become hypo again. And the main reason is because you have an active autoimmune reaction on your thyroid. You have Hashimoto's. You have antibodies that are signs that your thyroid is being attacked. And that means it's getting destroyed, which means that more and more function is being lost. Which is why the sooner you can address this problem, the greater chances, research shows that you can come off medication. But the longer you're on it, the harder it is. However, there is hope. You still can get better. All right, and so the first thing I always say, and you can go to our Facebook page, go to drswarren.com. There's a thyroid menu right there, button you can push in the menu. And right there, I have a thyroid ebook of the Optimal Thyroid Labs. If you need to make sure that you have the right labs, because I have a lot of people that say, well, my labs look okay. My doctor says it looks okay. And then they come in and I get on a virtual consult with them and I pull up the email and I'm like, this is only one lab. And there's 7 labs for the thyroid. Of course your doctor says you look okay. In fact, just recently on a consult yesterday, I have a coaching client who is having troubles converting. So if you're on a T4 only medication, it needs to be converted in the liver and the gut. And so this person was already having some digestive issues, so we know that their digestive system isn't optimal and their liver is sluggish because of other things that they've had in their health history. And so when we pulled her labs, we saw that the T4 was high. It was on the upper end, but her T3 was low, on the really low end. And so that means that she's taking T4 medication, which means she's not converting it. And so is it possible to have high T4 and still feel hypo symptoms? Absolutely, if you're not converting it. And so I had her talk to her doctor, her prescribing doctor, and she goes, my doctor says that I should be fine because my body will convert T4. I'm like, ideally, in an ideal world, but if your thyroid is off, I can go ahead and put money on it that your gut and your liver is going to be off too. And so her doctor's actually changing her medication and working with her to get on a natural desiccated because she is having a conversion issue. She's been on it a long time. So if you want to look, do I have the right labs? Do I need to order the right labs? Whatever it may be, go to drswarren.com, go to the thyroid menu, or you can go to drswarren.com/thyroid. You can sign up there and get that optimal labs, and that's definitely the first place to start. But what you've got to understand is that once your thyroid is off, that's already telling you, your thyroid kicks into gear when your body's under stress. And so a lot of women have had a stressed out body because of estrogen and progesterone imbalance. And the one thing I've learned in being in practice now with doing the virtual health coaching and seeing more and more women all over the US is that you could possibly, I've had certain women do this, you could possibly ignore the hormone problem long enough, but it will eventually show up during perimenopause and menopause. So that you don't want that. You don't want to keep on putting it off. And that if you are in perimenopause and menopause right now, you have to address the problems that you've ignored in the past. And so a big common thing that we see in regards to women's hormone is high estrogen, estrogen dominance, and low progesterone. And what does this mean is that when you have a cycle, you're the first part of your cycle, or when you had your cycle, your estrogen is slowly rising, and then it's peaking. And then the second part of your cycle, the estrogen kind of comes down, and then your progesterone goes up. Now, that's not just for getting pregnant. The only way you produce progesterone is if you ovulate, so you have to release an egg. But we most commonly think about that process only with getting pregnant. But what you've got to understand that process is what makes you a woman. It's what allows your body to function and to be balanced. Having adequate estrogen and progesterone is so much more than just getting pregnant. Estrogen is heart health, which is a really big deal. You need proper estrogen for heart health because the number one killer amongst women is heart attacks, heart disease. And we have estrogen all out of whack and out of control, you're setting yourself for a heart attack. So estrogen is what makes you feel great as a woman. It's that gives you the full lips and the hips. Also, it's what allows you to fight heart disease. It's for brain health. Osteoporosis, guys, the most common complication in aging is falling and fractures, because you can have an embolism or end up in the hospital with pneumonia. So you get, I have women that say, oh my gosh, my doctor says there's osteopenia on my, my bones. And I'm like, yeah, that's because your estrogen has been out of whack for decades and they've ignored it. So you got to get adequate levels of estrogen. And then progesterone is what makes you feel good and balanced. It's a mental hormone. A lot of the jokes about menopause and PMS is about moodiness and anxiety or depression. Oh, that's just PMS, or lashing out at people. No, that's not just PMS. It's a lot of times a sign that you have too much estrogen and really low progesterone. It's hard. It's hard to live in your body and feel like you can't control your emotions. And you think you're kind of going crazy or something's wrong with you, or maybe it's just because I'm a period, or maybe it's because I'm going through menopause, when in actuality your body's saying, hey, progesterone is low, and progesterone is a neuroendocrine hormone. It's not just a sex hormone. It works with GABA receptors in your brain. It allows you to rest and sleep at night and feel good about yourself. So when those are off, you're gonna affect your adrenals, you're gonna affect your thyroid, you're gonna affect your overall balance. And so guys, if you're listening to this and you're like, man, I that's me, or that's my sister, my daughter, my wife, I really want to get down to the cause, and I want to see what it looks like to actually identify these issues and put a plan together to get well. You can give me a call at the office. Sophie's standing by. I do offices, anyway, I don't know why I laughed at that. But anyways, I do appointments in the clinic here in Chattanooga in Hamilton Place, and I do it virtually through Zoom all over the U.S. So if you're listening to this and you're like, I'd love to take one of those appointment times to sit down with Dr. Rebecca, give Sophie a call. That number is 423-362-5360. Again, that's 423-362-5360. I know sometimes people call at the same time, so if you're not able to get through, leave a voicemail and she'll make sure to hold that spot for you. I only have a selected amount on my schedule because we are a little busy, just a little bit, but I'm so excited. I love doing these consults because you send in your paperwork, you end up doing this really thorough intake form, and we kind of just sit down together and really walk through all of the things throughout your life where you thought, yeah, that's not right, or yeah, that's off, and man, I wish someone could help me. I get to sit down with you and say, yeah, when you were 30 years old, you were right. Yeah, that was something that was off. That was something that was wrong. And I love being able to empower women. And I think real women are powerful human beings, okay? The fact that we can grow a child, birth a child, feed a child with our body, the fact that we can run and go, because most of the women I know are running themselves crazy and rushing and doing all these things, and that our health can't sustain us for so long. We're incredible beings, and I think the biggest thing that bothers me the most about what I do is every time I have someone come in and they've struggled for so long and they felt like maybe it was on their head because their doctor said it was fine. The thing that bothers me the most is women believing that their body has failed them, is women not understanding how incredible their bodies are. We can end up hating our bodies when we're not able to lose weight and we're trying to exercise a lot, or hating our bodies when we don't feel it well, or hating our bodies because their cycles are horrible, or they're gross, or they're painful. And I definitely feel like God's called me to really take up this, what do you call it, like baton, or pick this up, and I'm very passionate about making sure that not only you're able to get well when it comes to your hormones, but to realize how incredible your body is and to see that happen through the work that you do. So if you'd like that appointment time, give us a call. At numbers 423-362-5360. All right, so let's go ahead and tie everything together. So, I had someone in my office who had experienced an ovarian cyst. She had right when she had started, she had experienced a cyst right at the beginning, and she went to her OBGYN, and her TSH, which is thyroid stimulating hormone, cysts can be really painful. Her TSH was really high, and so the doctors were like, well, let's just wait and see on that. And it was like, okay, first of all, what does that mean? When you tell someone let's wait and see, that just means let's just wait till it gets bad enough, and then we'll get you to a specialist or get you on a medication, because that is exactly what happens. But let me go ahead and tell you what happened. So she comes into me and she's like, they say my TSH is high, I don't know what to do, like how does this happen? I go, well, you got to take a step back. You just experienced something painful, and not only painful, but cysts occur in the presence of abnormal sex hormone balance. So we know that your estrogen's out of whack just because of other things that happen. So we got her on a supplement regimen, and we started to detox just a little bit, just softly, with what she had going on. She started getting adjusted to make sure that her body is balanced and able to communicate. And I told her, listen, you're going to start doing this, and your TSH is going to come down. Because your thyroid stimulating hormone is from the brain to the thyroid. It's the pituitary. And so the hypothalamus and pituitary they influence all hormones in your body. So if the hypothalamus and pituitary is working overtime because of high estrogen or progesterone issues, well, I'm not going to be surprised when it's working overtime with the thyroid. So in a matter of 6 weeks, her TSH had went up to like a 6 something, and it was down to a 4. And the doctors were like, well, still, you should go see an endocrinologist. I mean, it's the same thing over and over again. But the big thing to understand is that, when your sex hormones are off, your thyroid will get influenced by that. And so how do you know, your sex hormones are off? So like I said, high estrogen can cause problems with your period. There's endometriosis, there's PCOS, painful, heavy periods, irregular periods, short periods. There's different things that are going to contribute to that. But your period is actually a vital sign, or your period was a vital sign. Meaning, if you went into the doctor, and this is not coming from me, this is coming from the College of OBGYNs, okay? So what they said is that your period is a vital sign, meaning if you went to your doctor and you had high blood pressure, they wouldn't just say, well, God, they do actually sometimes just say, oh, well, you have high blood pressure, let me get you on a pill. But the point is, if you had high blood pressure, it'd be like, whoa, there's something wrong here, let's address this. So that's what your menstrual cycle is, a vital sign. So if you have any of those things going on, gallbladder attacks have been associated with that, tonsillitis, sluggish digestive system has all been associated or connected in some way with estrogen and progesterone, because they have receptors for that. Now, the biggest thing I would say, to give you guys some pointers right now. So if you have your cycle versus if you've gone through, if you're going through perimenopause or menopause, this is what I would say. If you believe that you might have one of those things, you can do. So if you have your period, you can get some blood work done. If you're going to test your progesterone and estrogen, you need to, and I know your doctor probably won't tell you this, but if you're going to get blood work done, do it around day 19 to 22 of your cycle. You're going to see more optimal results and really know where you're at. So if you want to check estrogen, progesterone, sex hormone binding globulin. And so if you're going through perimenopause or menopause, perimenopause, just being aware if you're spotting or when your last period is and counting from there. But menopause, just go ahead and getting that done. But if you're having your period, some of the biggest things that you can do to address estrogen dominance is decrease your exposure to estrogen, changing out your sanitary products like stinking pads and I just had a brain fart, tampons. They're sprayed with herbicide and pesticides. They're chlorinated. I mean, they have all these chemicals on it, and we're putting it right, you're putting it right near your vagina. And I had a young woman in our office that had severe pain, switching out, the first step was switching out her sanitary products, and there was a big change there. It's so crazy that even myself when I was younger, I never put 2 and 2 together, that I'm putting all these chemicals near such a sensitive area in my body. So that's the first place to start. The second place is to detox your home. Don't hate me, but fragrances are major endocrine disruptors. They're going to wreck with your, estrogen levels, and then they're going to bring down your progesterone levels. So it's just taking it one step at a time. If you're going through perimenopause or menopause, you can do those same things with detoxing your home, switching from plastic to glass, switching to more natural products. If you go to EWG or Skin Deep, you can put in the products that you're using and look at how toxic it is for your body. So start there and know that every step you make to decrease your exposure matters. You might not see it, but in the long term, it does matter. Then the next thing is clearing out toxins from your body. So we're about to go on break right now, and I would love for you to tune in right after the break. I'm going to be talking about, okay, now how do we just, get down to the cause of just clearing some junk out, and if you have different diagnoses, how to start addressing that. Guys, if you'd like that appointment time with me, you can give Sophie a call, setting up a time. It's about an hour and a half, either in our clinic here in Hamilton Place, next to the YMCA, or virtually everywhere in the U.S. We do a lot of our coaching virtually as well. That number is 423-362-5360. Again, that's 423-362-5360. This is the Wellness Radio. We'll see you right after the break. All right. So, Dee, I'm not sure if you're still on, Dee. If you are still on, comment, because I'll go back into what I was talking to you about in regards to the thyroidectomy and what to start doing with the body. And I just got a message. Let's see if this is a question I can address here. Okay, I know I got a message here about a question, and I don't know how to get to it. It's okay. All right. Okay, Dee. So if you guys sent me a message, I'm sorry. I can't see it right now. I know someone sent me a message, and let me check one. So, Dee, we'll go ahead and talk about your thing. Yeah, I can't see that message right now. Sorry. I will come back and message you, whatever that question was. So, the biggest thing is, if you've had a thyroidectomy, is understanding that doctors nowadays, even the best endocrinologists, don't even know what to do with people with a dysfunctional thyroid. You can imagine if they don't know what to do with someone with a dysfunctional thyroid, they don't really know how to truly help them. They're not going to really know how to help someone without a thyroid. So what it comes down to is my own personal experience, my own journey is I still needed to heal my body. I still needed to heal my gut, and I needed to detox. And so that meant the first thing I had to do was go from a T4 only medication to a T4 T3. And the reason why is because I needed access to already converted T3. My body wasn't adequately converting T4 to T3. So T3 is the active hormone that's going to connect with your cell receptors, work with the mitochondria, create ATP, and have healthy cells. So that was the first thing I had to look into. And a lot of the people that I coach that have had thyroidectomies, have had thyroid cancer, that's the first place they have to talk to their doctor about. And if the doctor's not knowledgeable in it, they go find someone who is. T3, once you start exposing your body to adequate levels of T4 and T3, then you can really get supported in regards to, really addressing those symptoms. Your symptoms start to go away in that first place. Then the second thing is then going down to what originally caused the problem in the first place. My kids are running around here, guys, so just ignore that. So what that means is the gut microbiome, because that does influence your ability to absorb, you see him, absorb your thyroid medication and convert it, and then supporting your liver by detoxing. So there's a lot more that can be done. I find a lot of people that have had their thyroid taken out or radiated, her endo won't prescribe desiccated thyroid hormone. Okay, so then you got to go to someone else. I'm pretty straightforward about that with all of my coaching clients is then she fires that one and she finds someone who's going to work congruently with what her health goals are. And there's a ton of endocrinologists and general practitioners that will prescribe it. Well, welcome back, guys. This is the Wellness Radio. I'm Dr. Rebecca from DoctorsWarren.com and Facebook, Doctors Warren. We have a health center here in Chattanooga. located in Hamilton Place, right across from the YMCA, next to the Home Depot. And we do virtual health coaching all over the U.S. That's why I said you can find us on Facebook, because we have a lot of really great resources on our Facebook page, and I am live right now answering questions on the Facebook Live video. And if you, I know people have been sending me messages. I'm sorry, I can't find the messages right now. I'm not very tech savvy, but I will respond to your message as soon as I get a chance. And so today we're talking about women and their hormones, and we are usually here every Saturday morning from 10 to 11. And so if you have any questions about, if you've been listening and you're like, I have a question about my hormones or hormones in general, you can give us a call here at the studio at 423-267-1023. I know I never really share the phone number ever, but I thought today, if any of you guys are listening, but I find that people feel more comfortable just messaging me on Facebook because they don't have to be live on the radio. Usually the men, they'll call at any point with any question about anything, and sometimes not even a topic about what we're talking about. We had one congressperson, I don't know, some political guy call during our show and like plug something in. I'm like, what? But like, I find that women tend to be like, meh, I don't need to do that. I'm gonna get down to the point. I don't need a lot of show. I just need an answer, and they'll message me. So you can do that as well. And so we talked about, okay, so the thyroid, addressing the thyroid, and a lot of time, let me go ahead and tell you this, guys. I just had someone on Facebook Live say, you know, my daughter had a thyroidectomy, wants to get a natural desiccated thyroid hormone. Her endocrinologist says no. And what I say about that is this: then don't go there. This is the thing. There's so many different doctors, and it's so interesting because the doctor, and this is, living in the South, I'm from Florida, I'm Hispanic, I'm like, what? That is, whatever. Like, but a lot of people are just like, but my doctor is so nice, and they're just, they're really nice to me, and they've seen them forever, and I'm like, yeah, but you're still sick, or they can be nice and still suck at helping you reach your goals. And so I say that it's because there's so many doctors with so many different backgrounds, and if you end up in someone's office whose professor wasn't passionate about the thyroid or didn't have the adequate information, or if you end up in a doctor's office who's not reading the most up-to-date research, or you end up in a doctor's office that they're really getting a lot of pressure from insurance, there's so many things that can influence a doctor's recommendations for you. And so I'm not telling you like, oh, just go shop around for doctors, but what I am telling you is that you need to find someone whose knowledge and experience is congruent with where you want to go. I say this all the time to new moms that are pregnant that come in to see me. I was like, well, if you go see a doctor who's really, 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 really good at surgery, that's what they're comfortable with. That's where their expertise is. And so you're asking someone who's good at one thing to do something else for you. That's not, how that works. And so when I had to reclaim my health and my hormone health, I had to look for doctors that were going to walk alongside me, not fight me. And back then, 15 years ago, there wasn't a lot of people prescribing natural desiccated thyroid hormone after my surgery. And so I went to the prescribing, pharmaceutical website. I found that they had a list of doctors, and I drove to a specific doctor. I sat and I talked with this guy, and he listened to me, and he prescribed it, and he kept track of my labs, and he listened to me, and we worked together on my health. And I'm so thankful that he wasn't staunch and egotistical, that he was able to see this young girl that was very, very knowledgeable, who wanted to take control of her health. And he worked with me, and I'm so thankful for that, because I was able, without a thyroid, to get on the proper dosage and to start seeing kind of my body start to change. So if you are in a doctor's office and you're still having symptoms, or you have a diagnosis, I've had people say, I don't have any health issues. And I'm like, yeah, but you're on blood pressure medication, cholesterol medication, thyroid medication. If you got rid of all of that, you still have an issue. You need to make sure that you're having someone that is going to work with you. You know what's nuts too, and this is the last thing I'll say about this, and we'll get back to the hormone. What's nuts is that like someone will go to a chiropractor and they didn't like their experience there, so they're like, look, I don't care about chiropractic, they suck. And I'm just like, you went to one person. There's like thousands of chiropractors, even here in Chattanooga. You go to one person that you didn't vibe with, or you didn't like what they did, and then you write off the whole entire profession. There are medical doctors that are killing people by properly prescribing pain medications and surgery errors, and then no one ever says, I'm not ever doing medicine again. No, in fact, some people will still go to the same doctor who's never helped them get well. So I just want to point that out because I think it's interesting. If you go to a chiropractor, you didn't have a good experience, go to a different one. I mean, there could be 3 chiropractors down the same road, and all 3 of them can practice differently and do things differently, have different philosophies. So you got to find in any field the right practitioner that is going to work with you guys. You spend so much time, like, you know, if you're going to buy a new car, you're going to research, you're going to Carfax, you're going to look, you're going to drive, you're going to check somewhere else, you're going to do all this stuff, and you're just buying a car. But when it comes to our health, we kind of just go with whatever just because they're nice or because they're good or because they work at Vanderbilt. Just because they work at Vanderbilt doesn't mean it changes anything about possibly their experience and their ability to help you. Because there's plenty of doctors here in Chattanooga, I know nurse practitioners that are doing more for people here than some of the medical doctors that I see. So it's about finding someone who's knowledgeable and who's going to work with you, not against you. So in the end, now when it comes to balancing out thyroid and your sex hormones, I said, I'm not even kidding you guys, detoxing your home is vital. I mean, over and over again, every time I read the studies, and you can just go to PubMed, look up phthalates, look PCBs, look at BPS, just put it in PubMed, which PubMed is kind of like this pool of all these peer-reviewed research, and it's there. It's not a question about it that the chemicals that these companies are putting into the air that are selling you on stuff are killing you slowly and over time. So by the time it does kill you, by the time it gives you a really severe diagnosis, you're not even putting 2 and 2 together because it did it slowly over time. So I definitely think it's worth it, and the more you spend in a certain area, the more companies realize, hey, I need to start changing things up because that's where the money is, okay? Now when it comes to the thyroid, now there could be different things. There could be Graves' disease, which is hyperthyroid. There could be hypothyroid. Again, going to drswarren.com/thyroid, you can get my Optimal Labs ebook. So you can make sure and look, do you have all the right labs? In fact, on the ebook, I have one page that you can just take a screen cap on and save it on your phone. So when you go to the doctor, you can just show them your phone, hey, I would like to get this checked out. Make sure you're getting the right labs. Even if you're on the medication, you know, the thyroid is this vital adapting organ that changes according to our environment and stressors. And so a lot of times people need way more support than what they're getting through the medication. And so that's a really important conversation to have with whoever's prescribing you those medications. Next, now supplementation. I'm a big advocate for minerals because minerals, we used to get it from our soil, and our soil is so completely changed, and we're just not getting minerals. When it comes to overall immune health and thyroid health, I'm a big advocate for selenium within a complete mineral complex. You guys can go to our drswarren.com, shop our supplements. We do Designs for Health Complete Mineral Complex, and you can get it on there. And I do that with iodine. And so iodine is amazing for the thyroid. I know there's a lot of mixed information out there, but it's because a lot of people would do high-dose iodine and not take in selenium. Those should be together. Now, when it comes to irregular cycles, I will tell you there's one supplement. There's a few supplements that I love, and it depends. So don't go out there and just be like, I'm just going to buy the supplement and take it a lot of it. You got to make sure that this, connects with the symptoms that you might be having. But stuff like, we know for a fact Vitex, which is chaste tree berry, has been so helpful and beneficial for regular, allowing cycles, supporting cycles to be more regular. It's an amazing herb, and you got to do it safely. So of course, if you're going to do something with the crazy dosing, make sure you talk to a practitioner about that. But DIM is a good way to allow the body to, DIM is from cruciferous vegetables. It's a really good way to detox the body of estrogen. Now, you're like, cruciferous vegetables? I heard I shouldn't eat cruciferous vegetables and my thyroid is not healthy. That's caca, okay? Cruciferous vegetables are powerful, amazing types of foods. I mean, for you to eat enough cruciferous vegetables to cause a thyroid issue, there have to be tons and tons. We do say with cruciferous vegetables, it is helpful to just lightly steam them or lightly cook them. So, guys, I am Dr. Rebecca. I'm from drswarren.com. If you guys are looking for answers, if you're looking, you're saying, hey, I just listened to this, or I just caught this last end. If you want to know more about us, you can go to drswarren.com or go to Facebook at Drs. Warren. But if you caught the tail end and you're like, man, this is what I need. I need somebody who's going to walk alongside me, that's going to coach me on how to get my labs, on how to take my supplements, on how to eat for healing, how to detox my body. That's what I do. I walk alongside each and every one of my clients. I do it locally here in Chattanooga and virtually online. And so if you'd like to set up an appointment with me, you can give Sophie a call. That number is 423-362-5360. Again, that's 423-362-5360. I'm also going to plug this in. On Thursday, I did a Facebook Live. So if you currently have your cycle and you're trying to figure out, hey, how do I treat my cycle like a vital sign? How do I look at my cycle and understand what's going on, and how do I chart it so that, number one, I don't get pregnant if I don't want to, number two, I can get pregnant if I want to, aside from there being other underlying hormone issues. I did a Facebook Live on charting your menstrual cycle on Thursday. It's in our videos on Facebook, so go on to Facebook at Dr. Warren. You can check that video there. And if you guys have any questions, come on back to our Facebook page and you can comment on the video if you didn't get a chance to ask that. So I'm just really excited that we got to have this second hour today. We're here every Saturday from 10 to 11. Again, we have a clinic here in Chattanooga. We also do virtual health coaching all over, which is a lot of fun. We make it super easy for you. Listen, I just did a consult yesterday with one of my older patients. She's like, this is amazing. I'm doing it. I'm like, congratulations. But again, if you'd like some help, give us a call. You can give us a call at 423-362-5360. Again, that's 423-362-5360. I hope you guys all have a wonderful Saturday. All right, guys. And so, Dee, I hope that helped you some. I think the biggest thing to understand is that there's more to it than just like, feeling crappy after a thyroidectomy. I'll tell you what, I felt bad after they cut out my thyroid, and I was irregular cycles, and I wasn't able to lose weight no matter how much I worked out, no matter how much I ate like a bird. I was practically vegan for a couple of months. But I think that's the hardest thing, is when you're a woman and you're feeling like things are off, and your doctor's saying it's not. They're telling you, no, how you're feeling isn't right. It's insane. That's when you step out and you find someone else. So if you guys have any questions, I think Rosie wanted to say hi, guys. Here's Rosie. This is what happens when I heal my body. I end up having 2 kids in a year and a half. Can you say hi, everybody? Say thank you for tuning in. And Elijah, did you want to say hi to everybody? Okay, let's see if I can get these. Oh my gosh. Hi. Hi. It's a crazy day. Well, you guys, and here's Dr. Nathan. Hi. We're all just going to say hi to everybody. You guys, I hope you have a wonderful Saturday. We'll see you next time.
See ya.